Hi, welcome to the Civic Lens. I'm your host, Makena Kimaita. Stay engaged, stay informed, and see the nation through the Civic Lens. Hello, everyone. Welcome to episode 2 of the Civic Lens. I'd like to introduce my guests today. To my left, Mr. Karumba, well known as DJ Kroba. And to my right, Tetezi Wetu wa Health, Mr. Dennis Miskela, the Deputy Secretary General of KMPDU. Karibuni sana.
Thank you.
I'd like them to just introduce themselves before we delve into the topic of the day. So starting with DJ Kroba. You'll allow me to call you that?
Yeah.
Okay.
I'm very okay with that.
Yeah, go ahead.
So my government name is Karumba Ngatia.
Mm-hmm.
I am a husband and a father, and I am a wheat farmer.
Mm-hmm. Nice to know.
No, that's just a joke. But I'm popularly known as a DJ and sound designer. Yes.
Pleasure to have you.
Asante sana.
Thank you for honoring our invite.
And an
once more.
activist.
Yes. That's why you're here.
That's why we are here.
Exactly. Then to my right, introduce yourself.
Thank you very much. I'm Dr. Dennis Miskela. I'm the Deputy SG for KMPDU. But beyond that, I'm a trained gynecologist by profession. So when I'm on the labor ward, I'm in the labor movement. If I don't deliver babies, I deliver promises.
I think with that introduction, you can tell the type of episode we are going to have.
I like your intro.
I know, right? I'll use that in future. So we're going to talk about NHIF. I think when I say that, you see, I'm still calling it NHIF just because my mind has not yet shifted to SHIF and SHA.
Yes.
And Taifa Care. We have, what's even the name, you know? The reason I wanted to have both of them is to have a perspective from a doctor, an activist, and also Mwananchi who's really going through it with SHA and SHIF and Taifa Care. I think I'll call them the three of them because we all refer to it differently. The fundamentals of what is wrong. And it is such a pertinent issue. We are constantly talking about it, and this is actually like we are losing lives. It's not a joke. And I don't think this government really understands. This government, I don't think they understand when we speak. When we speak and we call them out, we are being too much or we are not understanding. How do you pay an intern doctor 70,000 and you've still not cut them the taxes? How do you say there's no money when you're adding 5 billion bob to entertainment, salaries, and travel? How do you say the country does not have money when governors are spending billions of money to travel, to go and do, what is it called? Benchmarking. What are you benchmarking? It's a lot. And so the doctors have given the government an ultimatum that they're going to be on the streets from 18th of March. There was already a very big strike last year, and we saw how that went. And now we are back here. So I'll start with Daktari. And sorry, I didn't introduce you as doctor.
Okay.
Dr. Daniel.
Okay.
Sorry, Dennis, sorry.
Yeah.
So just tell us what is currently the state of doctors and what is the union doing in terms of their salaries. Let's start with interns, who, by the way, 2 of them have already committed suicide because of the pressures of, careers are different. For doctors, it is more of a calling. These guys work crazy hours. They don't even have, genuinely, they don't have a life, especially interns. You know how interns are. You do the proper donkey work. You're learning and everybody is throwing work at you. You must do this, you must do that. So you're working crazy hours. You don't have salaries that are delayed. I'm hearing clinical officers saying they've not been paid from last year, June. What exactly is the state? And when you're talking about the strike on 18th, what exactly are you asking the government to do?
Nice.
Yes, Dennis, you can go ahead and answer that.
Yeah, so thank you very much. First of all, healthcare is something very big. And the UHC that you keep on talking about, it stands on certain pillars. And there's the pillar around building the hospital, the infrastructure. After you build the hospital, you have to put the equipment, the lab, theater, and all that. you have to buy the drugs. Then you have to employ people who are going to work there. Then after that, you have to put a system that you capture the patients and their conditions.
Mm-hmm.
When you are done, you have to finally find a way of financing this process. So when you're financing this process, that's where SHA comes in. Because there's nothing called free healthcare. Somebody must pay for it.
Mhm.
Either from your pocket, from our taxes, from private insurance,
Mm-hmm.
from donors. Somebody must pay for that healthcare. In Kenya, we have built enough facilities. In fact, the WHO infrastructure per capita for the population, we have surpassed the recommendation for obvious reasons that there are kickbacks in the constructions. You get that?
Okay.
In the equipment, we have the managed equipment scheme, which was a scandal. It went with Kuhuru.
Mm-hmm.
Now we have a new scheme with the governor signed the other day for bringing equipment for obvious reasons, tenders. The only challenge you're having now is that SHA, that was supposed to do the financing, is being problematic.
Mm-hmm.
Then the human resources, we are seriously understaffed. We have 1 to 17,000, one doctor to 17,000 Kenyans against a WHO recommendation of 1 to 1,000.
Yeah.
Do you know what that means? It means that every time you go to the hospital, you're in a longer queue. You'll be told that the doctor is out there doing locums, doing private things. But the truth is that there's nobody there. So that today there's a woman who woke up in Kawangware. She's a mama for in Kilimani, and the child was having fever.
Mhm.
And she has to decide that, do I go to the hospital and stay the whole day? And my other children will starve. Or do I go do the laundry, come back and get my baby dead? Because of the queues that you have to endure when you have to go see a short number of... There are real life situations. You get that? Interns then come in. 30% of healthcare workers are interns.
30%.
30%. So they feel a huge gap.
Yeah.
And they're not at learning per se. They already graduated.
Mm-hmm.
They just need to have that license that CAP 253 of the KNPDC Act forces them to go through that experiential learning. So they work.
Mhm.
As a doctor, the most difficult time of my life was as an intern. And I'm talking like I was in masters for like 5 years. But that 1 year was the toughest time of my life. Is that a joke? Yeah. So, and when you look at it from the financial aspect of it, that 86 billion is used to pay healthcare workers annually. So if you take 30% of that 86 billion, interns cover around 26 billion worth of work. Yet the only money you're fighting over is 1.2 billion.
Only.
So,
No.
so
Yes.
because to
God.
pay all interns is around 5.2 B. So interns itself is value for money.
Yeah, it is.
Oh my.
And even the 206 keep on quoting, the only take home they have is like 146K. Because after all the deductions, 146K. And the money they raise when they're doing a shift is enough to pay them for the whole month. Because they do like 10 cesarean sections. They do so much. So there's no way we are going as a union to accept anything. And worst of all, that even the 206 was that in 2013, we had a CBA with government.
Yes.
They were to pay 357,000. It is government who refused, and we did a 100-day strike. And they said, no, we can't pay 357, we can pay 206 based on a research done by SRC on the value of work. You get that?
Mm-hmm.
And they've been paying that consistently for the last 7-8 years now. We asked them the other day when they were reducing these figures that, can you show us the research that SRC has done again to show that the interns work has now reduced from what you did in 2017?
Mm.
Now, what has changed? Because the 206 was your own figure after a scientific process. Now you bring up somebody's opinion and you want to use that to go against an agreement that was signed and put in court. So come last year, when the issue began, we pushed back and we were able to have our way, obviously. But I can see this year again, they are back to pushing. And we have done our research.
Mm-hmm.
The issue why we are fighting over this issue has nothing to do with money in public sector. It is purely because the people in government themselves own hospitals. And their managers tell them that the cost of paying entry doctors is too high. Because a doctor is paid around 250 to 300,000.
way.
Are you joking?
Yes. So when they were told
way.
that is too high, so they're like, how do we reduce the salary? So like, let's start by underpaying them 70 gross 40 net, so that when they become doctors, we pay them 100K. So it's just about
Oh.
a private interest
God.
influencing public policy. Very sad.
You are kidding me.
It's terribly sad.
Wait.
Yani, a few people who own a few hospitals
Yes.
are causing all this pain to us.
Bro, even in 2017 when we were pushing for the salaries, I remember
Jesus.
private sector guys, some guys said that pay them 250 so that we pay them 300. Because as in, instead of public interest guiding public policy, it is private interest guiding public
Private
policy.
policy.
Oh,
That's
man.
crazy.
Basically.
We can't have a country that is
We can't run a country
pushing
like that.
private interests. It's a terrible situation, I tell you.
Wow.
Well,
Now I see why you're going to the street. 18th?
now 18th of March.
And
That's
Aki go.
we'll support you. We will bring the doctors food like we did last time.
We appreciate
will
it.
bring you
Wow.
shelter like we did last time. I mean, I think collectively after 25th of June, this is a very different country. Did you know?
Oh,
Actually,
yes.
it's a very different country. I mean, anybody can andamana. Maandamano is just part of our DNA now.
But
I think
But
you
you
know,
know-
the doctors who brought up that issue.
I know.
Initially, guys were so scared. Oh, we can't. What will happen? Then doctors said, "Come on, what do you fear? What's the worst that can happen?"
that's actually, I think
Yes,
when
and we
Davji
hit-
was
yes,
injured,
Yes,
Davji was injured and
Yes.
then the thing just
yes.
exploded.
And that's how Gen Z said, like, Kuba, it's possible.
It's
You can do
possible,
this.
yeah.
Yeah, and people pushed back. And we are willing to initiate it again and push back again.
Now, before we go to DJ Kroba,
Yeah.
I want us to talk about, I want you to take us through the difference between NHIF now and SHA. Already, private and urban hospitals have said, we are no longer taking SHA. It is not working for us. The faith-based hospitals have said, we're giving the government 14 days ultimatum. If we are not paid, we will no longer take SHA. And this forms what I think they had said 45% or 30% of private hospitals form that percentage of hospitals in this country. And there's a politician who said, that's not a lot. You know, it's not, that's a small number. I mean, you know, public hospitals are the kusema, kweli. And I want you to take us through the type of impact that will bring. I mean, of course, I know the millions that are owed, the billions that are owed to hospitals goes back to 2017, that hospitals have not been paid. Just tell us the real life story on the ground. Is SHA working or not? Is it a facade or are we, you know, like what exactly is it? Yeah.
I like telling stories
Yes.
so that you
please.
can relate.
Yes, please.
And this is a story of SHA I want to tell you.
Mm-hmm.
So imagine that you have a neighbor who is a farmer.
Mm-hmm.
And you tell this neighbor that you are looking for a bird, an ornamental bird that can fly around. And this neighbor gives you a chick. And you know, this one, I normally sell chicks for 300 bob. This one I'll sell for 1,000 bob. Because it flies. This is a bird. Beautiful bird. So you have this bird in your compound, it keeps on growing. But it's not flying. Every time you tell them this bird is not flying, it tells you throw it up, it will fly. And when you throw it, it falls down. Then it tells you, no. At least it flapped its wings. Give it time for the feathers to grow, it will fly.
Mm-hmm.
But the feathers are growing, it's not flying. But this bird is laying eggs in the neighbor's compound in Dubai. Get that? That is what SHA is.
Uh-huh.
Wow.
It was never meant to fly from day one. It's not a bird.
Mhm.
But every time you tell whoever brought it that this thing is not flying, they're telling you, wait for the feathers to grow, it will fly. Every time you say it's not flying, at least it's flapping the wings. We want it to fly.
Mm-hmm.
And so with that story, there was an NHIF for the longest time, almost 50 years plus.
Yes.
Came from National Hospital Insurance Fund
Mm-hmm.
to National Health Insurance.
That's fund.
Yes. And NHIF was not perfect, but it did the work.
It did.
Mhm.
You get that?
Yes.
My mother is alive because NHIF saved her life. And so many stories can talk about it every other day. But somebody somewhere said that, no, let's put SHA. Because somebody somewhere said that these billions tuzitafutie kazi.
Mm-hmm.
Unaelewa? So they came with a very flowery language that will have the Social Health Authority. And the authority that three funds. The Primary Healthcare Fund.
Mm.
This fund is not from what you contribute. This fund is from government
To
treasury. It's our taxes. That should fund it.
Mm-hmm.
Then you have the SHIF, the Social Health Insurance Fund, that we contribute per month,
Month.
2.75. Then we have the Emergency Critical and Chronic Illness Fund, also from the taxes.
Mm-hmm.
You get that? So what happens is that when you register for SHA, government should pay the other two funds for you as you pay for only one fund. And the primary healthcare fund should cater for level 2, 3 hospitals, whether public or private. Remember that over 50% of Kenyans go to private hospitals. You get that? Then
over 50%.
Then when you just have a short illness, maybe malaria, admission 2-3 days, or delivery, SHIF will cover that.
Mm-hmm.
But in case you end up in an ICU
Mm-hmm.
or an accident or a disease that is prolonged, a chronic disease like a cancer, then the third fund, the Emergency Chronic and Critical Illness Fund, should cover for that.
Mm-hmm.
Now the problem we're having right now is that SHIF, the middle fund, is working loosely. You can go, that was the keep on saying that mtu alilazwa akatibiwa. But remember that the primary healthcare fund, they asked for 47 billion. They were given 4 billion only.
Wow.
Then the emergency critical care fund, they asked for 100 and something billion. They only given 2 billion. So clearly, in this case, we're having a case where somebody is trying to feed 5,000 people with 5 loaves of bread.
Yes.
It is statistically impossible.
It is.
Even if you pay tithes every Sunday.
It is.
You get that?
Wow.
That's why we are struggling.
Yeah.
Nobody. And then even the other day in the Parliamentary Committee of Health, they were asked that you are given 4 billion. Show us what you did with it for us to add you more.
Exactly.
And they said
I
that
saw
we only spent 1.35 billion.
Then
So
show us.
kidogo, they just spent less than half of it. But they say that we cannot spend it because there's no system for using it. Imagine that people are suffering because there's no system. Because the current system is only working for inpatient. And 80% to 90% of Kenyans every day go to hospitals for outpatient services. Nilienda nikatumia pesa yangu. Hakuna mtu anasema nilienda nikalaza nikatumia. So 80%, 90% of Kenyans are paying from pocket because our system is not there.
I was just mentioning to you before we started the interview. I remember vividly the former CS being asked on a show. I think it was Newsgang on Citizen. And that's the time they were saying it's going to be rolled out in June of last year. And I remember she was being asked, so have you tried and tested this system that you want to introduce, this SHA system that you want to introduce? And I kid you not, her words were, it's been tested in other countries, so it's going to work. So those are the kind of leaders we have. So over to Mr. Krober.
You know, when SHA was implemented, it was not an emergency.
It wasn't.
And that's the most heartbreaking thing about this situation. It was purely political and it was purely business for the companies that were in it. Other than that, the agenda was not, let's implement SHA so that we save as many Kenyan lives.
There was nothing like that. That's the story that we're being given.
And the reason it went hard was the moment it became law, it was fought really hard in court. I'm sure Daktari knows that.
Yes,
it was taken to court because they told Kenyans that if you don't pay for SHA, we shut down your e-citizen.
Yes.
Can you imagine? So I don't know how that cost ended up winning.
Yeah, we went to court.
I remember they went to court. Then they lost that case. They appealed, and then they won. The government won. They won, and I think a week later, I think they were not wasting time.
They were not.
A week later, they said, we are going hard on, was it October 1st or November 1st?
October 1st. October. It's been 6 months of
So
nothing.
I just wanted to say, before you even ask your question, SHA coming in was not an emergency.
It wasn't.
But now that we are here, it's good for us to tell Kenyans not to wait for NHIF.
It will never go back.
Regardless of how sad that is. It's NHIF is an act. National Health Insurance Fund Act has been replaced by Social Health Act.
Yes.
So it's a new act altogether.
So, and the law does not work retrogressively. So we have to move forward. Of course, the reason we call you here is because you've been very, very open about your wife's illness. And I'd just like you to take us through the journey of how financing that particular venture has been. Of course, it's been very, very difficult. I remember sometime last year, you had a pay bill that you're among those Kenyans who have felt the brunt of very, very bad healthcare system that now we've had to come in as Kenyans to help you. So I'd like you to take us through the story of how the journey began, how NHIF worked for you, and the situation you're in currently, and how that has impacted your life and that of your family in general. Yes.
NHIF covered my wife dialysis. My wife does 2 sessions.
Okay.
Per week. And so...
How much is one session?
A session then was 9,500.
9,500.
It's now 10,500.
How much was NHIF covering?
Everything. NHIF was covering everything. So, and mind you, at that point, my wife was under my cover. So she did not have any NHIF.
Okay.
It was my cover, and my cover covered my wife and kids.
And that's how it works.
And that's how NHIF worked.
Yes.
So when we transitioned into SHA, so the company I'm at, see, all the employees were transitioned into SHA.
Yeah.
So when we were transitioned, immediately we were transitioned, the first 3 or 4 days, there was no dialysis cover. Fortunately, it came through. Fortunately. But after a while, we realized that my cover does not cover my wife's dialysis.
How?
Because the way SHA is designed, is designed in a way that even if I am the dependent, the dependents need to have their own cover within SHA. Like, for example, we are now heading towards my wife's transplant, right? Okay. So when my wife is admitted, she will not be admitted under my cover.
She will be admitted under
her own cover. So her own cover is the one that pays for her dialysis now. So we had to create an account for her for that to happen. Even the donor who's donating, we had to create an account for her. So the way SHA is designed in a way that even if you have dependents, if the dependents are over 18, they have to have their own. They have to have their own. And you have to fill these... it's not a metric system. What are we calling it?
Mean testing.
Means testing.
Yeah.
Yes. And we lied terribly on that means testing to make it affordable because it is so expensive when you fill it up correctly. Aki, you fill it up correctly, it tells you are paying 40 Gs per year.
And my question is, how accurate is this means testing?
It's not accurate.
Because you see, you've said you lied.
Yes.
So even me, I know I'm going to lie. People are going to lie.
Very many people lie on that.
And you see, the issue is...
I did not even know how to do it. So what I did was, we called some guy and told him, how do you feel this thing? And then said, I'm going to fill it for you. And then I sat there and then I saw myself living in a mud house, in a latrine, somewhere. Okay, for me as a salaried person, so me, I'm cut.
Of course.
But for my wife, iliendapo ikikuwa toilet, what. Because ikiekwa, even for the lady who's donating for her sister, who currently doesn't have a job, alijaza honestly ako jobless. I think ilikuwa namwambia lipe 1,300 per month na ako jobless.
You see, fundamentally, I think that's why we are saying this
for someone who's jobless, inafaa kwenda as low as 300.
Exactly. What people used to give for NHIF.
No, actually, NHIF was 500, Bob.
It was 500,
Bob. It was 500. So it is a system that is very skewed.
Very.
Hiyo ndio shida yake with that particular nini of it. Partially, it is working. Now, let me just speak to the area where I am in under Renal Care.
Okay.
So under Renal Care, it covers dialysis for 2 sessions. For those patients who have 3 sessions, because they are patients with 0% kidney functioning, they have to do 3 dialysis sessions. The third one, you pay. Under SHA, you pay. You pay for your 3rd session. So their patients, every week, it has to cost them 10 Gs. Every week. So they need to have a budget of 40 Gs to stay alive.
Per week. Per month, sorry.
Yes. Or you put them in a machine and you try and squeeze out 5 liters out of them. Do you know how draining that is? Try and keep someone in the machine for about 5 or 6 hours. Even these hospitals, they're like, mtu lazima tumsaidie. So they try and squeeze in as much as they can so that you can do 2 sessions. But you need 3. Menishika. Under NHIF, what would happen was her cover would cover 2 and then mine would cover the third one. Menishika.
Yes.
But under SHA, that can't work. It can't work like that. Now, when it comes to transplant patients, there's pre-transplant testing. It covers up to about 150,000. Pre-transplant testing is actually very expensive. So 150 is a good dent because testing might cost you about 300 Gs there. The transplant itself, it covers to the tune of 700,000. And post-transplant, it covers 200,000. And that 200,000 is the better part of this new SHA contract under a dialysis patient is that it's annual because they'll be using immunosuppressants. So immunosuppressants are medication you take to lower your immunity so that your immunity doesn't kill the new organ.
Okay.
Is that making sense?
Yes,
So it was
does.
not covered under NHIF. And it is expensive medication. The cheapest one at Kenyatta goes, for a whole month, you might get it for about 28 Gs. So usually, one of the wisdoms we transplant patients are given before they pursue this route is, can you afford immunosuppressants?
That's the first thing you ask.
Because if you can't afford uko mbele ni kubaya, that organ will fail again. And someone has donated it.
Yeah.
Umenishika. So if you can't afford, it's a crazy route.
Yeah.
And for those patients who stay under dialysis, it's very hard to find a patient who's been under dialysis for more than 10 years. Usually maximum is 15 years because the body keeps going like this over time. So it's one of those journeys that is very difficult to be in. And now circling back to our topic under SHA now you know what SHA is covering under that.
Yes,
I don't know in other areas. In other areas how it's covering. But because my wife is a renal patient, so I have taken time to understand more about this renal cover properly, how it works. Yes. So that's how it works as of right now.
Okay.
Yes.
Okay. Good to know. And I think that's why Dr. you were saying some aspects of it work.
Yes. The challenging part about SHA now comes with private hospitals. When you're admitted in a private hospital, don't expect SHA to cover you. Technically speaking.
Okay.
Regardless of how much you're paying.
Okay.
There's a guy who was admitted here at Aga Khan. His bill was 500. Yes. That guy is cut 10 Gs. His 2.75 is 10K. So that guy has a good income.
He has a good income, yeah.
So he expected a decent cover. Because if you give a local insurance 60,000 per year, you will get a very good cover. Aki, for real.
Yeah. No, for real, yes.
For real.
True.
That is private cover. If you give 60,000 Kenya shillings to a local here, you get a decent cover.
And they were even saying there has been an increase in Kenyans taking insurance cover since October.
And this is
because I think kila mtu ameketi chini nako, you know what? Like you'll find some families where primarily you're using either the husband's cover from work and the wife doesn't have any. People are now taking the wife taking cover now, and you put your husband and your kids there.
Yes.
Because it's gotten to the point where now things are not making sense.
Now we shouldn't be there.
Yeah, we shouldn't.
The work for the government is to make life affordable.
Exactly. And now you see that's already denting our pockets, which are already dented.
This is why
for you to pay for that insurance cover every single year.
This is why the insurance companies will never complain about SHA.
They will never. Because it's benefiting them.
It's a cash cow for them.
Yes. Now let's get to the gist of this SHA system that costed us 1.48 billion. Now, I know this week we have been bombarded
it's over
with
100 billion.
Yeah, 104.8 billion.
Yes.
This week, the Auditor General has really busted our bubble. I think, you know...
Oh, you saw that report? Uliona hiyo report?
This is
daktari?
what I'm even reading here.
Ebu, soma.
Let me just read
Read a
it.
few sentences.
The government does not own or control the SHA system despite paying 104.8 billion. The private company that owns the system gets 2% whenever any Kenyan contributes to SHIF.
What?
Yes. 5% of all SHA hospital claims belong to the private entity. 5%.
What a
And
terrible
another
deal.
1.5% goes to tracking. I'll need you to help us understand what this whole tracking is. What are they tracking? Auditor estimates the firm is receiving 9.25 billion every year. And now hold on, the worst part.
Yes.
Disputes on the contract are to be decided in London. Tell me if we are madmen. They are to be decided in London, not our own jurisdiction. London. You know, this is as a lawyer, by the way, this whole issue of having arbitration in your contracts, my friend. It's a that's just a story for another day.
How can the government of Kenya sign such a document?
As KMPDU, let me ask you, did the government even come for a word? Did they come and ask you guys, by the way, as the union, what do you think? Are
Consulting.
consulting, because I want to believe. Okay, why am I talking like I don't know this government? Of course, they did not consult. And even if they did and you gave their views, if in a country where public participation does not work, something as simple as calling us to a hall and us to give our views about a bill, about a certain law, that does not work. I just want to ask, when did you by the first hear about SHA? And how has been your journey been with the government in terms of SHA? Did they consult you? Did they speak to you? So just give us the rundown of this system that we paid 104 billion for.
You know, I really get frustrated and sad when I keep on hearing that report, because when we first heard about the SHA idea, as a union, we said no. This thing can't work. And I remember very well, one day we sat with the DAVG and we went through that act and I analyzed it. And we did a 25-page report. And we went to Parliament, the Health Committee, and presented our findings and told them, we flagged all the issues. We told them, means testing is the most inaccurate way of knowing how much somebody can contribute.
Exactly.
Because today you have a motorcycle, you can pay 300 or 500. Kesho umegongwa na gari pale, motorcycle imeenda ma umeshikwa na kanjo, hakuna motorcycle, you can't afford it.
Exactly.
Tomorrow you have 10 cows, you can pay 1,000. Then food and mouth discount, they all go anthrax, they all go, you don't have a cow. You get that? We also told them that, look here, you cannot tell people in Juakali to pay annually. Then salary people to pay per month. Then tell them that if they can't afford the annual payment, utawapatia loan na kampuni ingine, walipange kampuni pole pole. You get that? That's in the act. That when you mtu wa Juakali, remember that 80% of Kenyans are in Juakali.
Juakali, yes.
Only 20 are salaried. That you pay annually, and if you can't afford the annual fee, they'll get you a loan somewhere to pay for you, then you pay the loan. We told them that, look here, this idea that the money collected by SHA goes to a private entity who then controls it and disburses it out back and pays back cannot work. Why do you take public money to private hands? We told them about that. Yeah. We told them that, look here, the system that can manage that process is already there as what in NHIF.
Yes.
You've only said that NHIF is bad because people are stealing. Arrest the thieves. I hear them quoting a CS done with the same woman 600 times. Thank you. Get the hospital and arrest the owner, close it down and jail people.
Yeah, that's
You
how,
have the facts
that's
now
how
with
the
you.
law works.
Just because a snake has got into your house, you don't ban it. Unless you have a construction company that will benefit from constructing a new house. You get that?
Come on.
So here we are. KPDU told them that you cannot force Kenyans that if you don't register, you can't get services. We went to court on that.
I remember.
Yes, that's how they ended up in court.
Yeah,
Yes.
I remember.
You cannot do that. People are paying, your taxes alone is enough to work for you without having to do anything. You can't force us. And I remember KPU said that if you were in Germany, where 80% of people are on a salary, this scheme can work because you just deduct them and. But we're in a country where the opposite is true. 80%. So you end up making only 20 people pay. That's why you see that we are, personally, I'm paying almost 10,000 per month on SHA. And my wife pays the same. So 20 G's.
Chini
per month. Then I pay for my mother and my dad. But I have a friend of mine, his dad failed. He's a low. So he was not to feel there. His dad is sick. Yeah. So he has been getting chemo using NHIF. They never used to pay anything. So when they went for treatment, it was all to fail the SHA. So this proud little man, his son, is a doctor. Feel how he lives in a concrete house. He has a flush toilet. He has a car with a driver, blah, blah, blah. So to pay 2,500 per month. They're like, what the hell? Now, it discarded that. Then he took the wives. And now they got abroad and lied to them until now they're paying 300 bob, 600 bob. So you see that whole concept can't work.
It can't.
Then finally, I also know my auntie who only registered for SHA when she's going to be admitted. So you only pay when you're sick. Ni kama wewe uko na gari, unaendesha bila insurance. Ukishaigonga ndio unalipa insurance. You can't sustain that. It's called adverse selection. Because Kenyans have learned how to beat the system.
Yes.
Wow.
Unaelewa? So in the long run, you end up burdening people. You know, they capped that thing at, was it around 5,000 per month? But they removed the cap for the maximum pay.
I actually remember there was that.
Yes.
There was that.
Yes.
There was the
Yes.
5%.
There was the 5%.
Yes.
It was
Yes.
removed because
No, it was 5,000. So
5,000.
that if it goes over 5,000, that's the highest
that's
you can
the
pay.
highest. But now this money you're collecting, now let me tell you about the report. Now let me come about the report.
Yes.
That every time you contribute 2.75% of your money to SHA, these shadowy businessmen first collect 2.5% of it. You know. Then after that, every single claim that is made, they deduct 50 shillings. Every single claim that is made. NHIF would charge, it would take all the claims of that Hosi, charge a fee. Right now, is if we three of us go to Hospital X, you'll be charged 50 bob, 50 bob, 50 bob. You get me? So this money is going to people's pocket. The system, now let me tell you the biggest scandal of all scandals. When the system was first put by these shadowy figures, it collapsed in 4 days. Do you know they had to look for a private firm in Kenya? I won't name them because you might be a lawyer, but you can't defend me. That company put a system that has been working quietly for $1 billion bob only. Yet, this other company is going to be paid 104.8 billion. And they're already being paid that money despite the system still not working for us.
Exactly.
Because you can say that until you bring it and make it work, we'll start paying you. But it is what it is. And that's why Kenyans, I keep on telling them that we must push back.
We must.
We must.
No,
the president can tell us that, oh, iko shida kidogo tungoje tunatengeneza mbele.
Hakuna kishida kidogo.
If you delay sending capitation, you can send it next time.
Yeah.
If you delay fixing a road, you can fix it in the next financial year. But once you are dead,
you're dead.
Once your kidney is gone,
it's gone.
Unless it is transplanted. If you broke your leg and you can't get the fixture, that thing is gone. Legs don't grow like a lizard's tail.
That is true. It's true. Yes.
I didn't know a lizard's tail grows like
that. They grow. Yes.
You cannot try that with people's lives. We refuse to allow the government to play games with our lives.
We do.
And as doctors, we see the pain. There's nothing as painful as seeing a patient there and you can't help them. You see life slipping out of their hands. It's sad seeing a diabetic patient going down, losing their sight. They go blind and you can't do surgery to save them. A kidney patient, a hypertension patient that's getting mismanaged and the kidney shutting down and they go and as you watch, right? As you watch.
Wow.
we told them that, look here, you can't tell people that to register for SHA, you must have an ID. Because we know that we have teenage pregnancies. We know people who don't have IDs but still get pregnant. We know that in Gikomba or in that area, the Burundians, Rwandese, Tanzanians who don't have IDs, but they have serious HIV and TB burdens. If you don't treat them because they lack IDs, then in fact
It becomes a Kenyan problem.
Common sense.
It's common sense.
But nobody listened. We even took our document through other means to higher authorities, that 25-page document. And it was marked like a campus essay, underlined the red lines and with answers. They have answers for everything except how to help Kenyans. Patients are crying. Hospitals are crying. Everybody's crying. The only person who says that SHA is working is a politician who has a private cover.
Who goes to a private hospital.
You're being told that the late Honorable Njendi was paid for 9 million shillings. We lost a baby for 1.6 million shillings the other day.
Wow.
You're spitting on our faces.
I think one of the things that is fundamentally wrong about this regime is kujipiga kifu. Do you guys see that these guys talk to us? I'm the one, they'll stand there and talk. And it's just the other day when this Kimtai guy from SHA was at a parliamentary meeting,
the PS for medical services,
in Naivasha, and it's when, the majority leader was like, and by the way, this SHA is not working. And I'm like, aren't you the same guys who passed the bill?
They know it.
Aren't you the same people?
Bro, I'm so pissed off. But the other day, when I saw the headline for Janati Clueless CS, because the CS couldn't answer the questions. I'm like, shame on you. Don't ask her questions. She was not there. You guys were there when this was being formed. And you guys were being bribed left, right, and center to pass it. Then you come here asking people questions.
But then again,
in fact, when she was asked, she said, we're having I really feel bad for her. She was saying, we're having challenges like every other country. And then she said NHS. And I was like, NHS is literally the pride of Britain.
The
because
epitome
of
the
how
world, literally speaking.
Amazing that system is. I know the only issues they have is scheduling of patients and obviously seeing specialists. Like you probably have like a 2-month wait period, but that is a challenge that I know for sure they're actively working on. You cannot spit on our face. Every time we raise something, even Singapore, they are taxed more. Or, this other country, they are taxed, but their systems work. So you guys, we are paying more for SHA and it is not working. I think everybody has a success story with NHIF. Regardless of how it had its challenges, I think people really, really have. I personally was admitted with my daughter in October and we paid for the bed cash. Because at that time is when SHA had just been rolled out. And I remember the bed was 4,000 bob. And my insurance was like, SHA is supposed to pay for you. I mean, we had no time to start calling. There is no line that was working. We even have somebody who works for NHIF, but they cannot even say we work for NHIF because personally, they cannot tell you what SHA is, what SHIF is. They do not know. And they work for NHIF. Or is it SHA? Or whatever it is we are talking about. So, Dr. we are obviously not going to go back to NHIF. So what exactly is going to happen? Because it is not working. We should stop like it is not working. So what recourse do we have? Because for me, I feel like, okay, we've complained. So what are the solutions? How are we going forward? How are we moving forward? And if this government is still there, like even if another government is to come, how are they going to correct this? We don't even own the system.
First of all, the government stop gaslighting us. This idea that every time you complain, you're being told, don't be like. The other day I saw some media saying that, why can't you use social media positive like China? And I was like, bro, why can't you not punish thieves like China?
Wow.
Yes.
They hang them over there. Yes.
They hang them.
Yes.
So if you hang the local thieves, you also behave the Chinese people are doing it on TikTok.
Exactly.
Selling their country. So the water is under the bridge that SHA is here. But the law allows that after 6 months, a law can be amended. Yeah?
Yes.
Can we then bring those changes? Yeah. I'm glad that they bring changes. For example, now the cancer care has moved from 400,000 to 550,000. Good move. The ICU amount has been raised perfectly. Now we have a number you can call and get help, because the challenge that was happening that any new system will have challenges.
Of course.
Even in NHIF challenges. But
Yes.
you'll call a customer care number
And
you'll
find
be
someone.
sorted.
Yes.
Problem right now is that those very people who work in that NHIF, SHA, whatever, who are supposed to help you, they are being fired. So you think they're going to help you?
Wow.
They're not.
Yes, they're being taken away to other departments.
Mhm.
So how do you help? And in fact, I have instances where they just refuse to help. So when a doctor maybe has a patient and they're struggling completely, they're lucky to have us. They call me, and I'm lucky to have friends in SHA. And I just
In
need
the
to just
industry,
send
yes.
the ID number and a phone call. And within 5 minutes, they're sorted.
They're sorted.
Now we have that 147 number that you can call to get help from. Those are the big moves. But more important than that, we have a new health committee with a new chairman. We pray for Honorable Nikal. He has his heart in the right place. He's a doctor. If he
Yes,
can
he's a
become
medical doctor, yes.
become the chair as proposed, then we can then push for those changes in the SHA Act from Parliament.
Amendments.
Because Parliament is the only place we can go to rescue Kenyans. And if they don't do it, if they don't debate the audio reports, general report, Kenyans, which camera, this one, Kenyans, make sure that to punish your MP and your senator.
Please.
Those two people, senator, MP, they are the ones responsible for your pain.
They are.
Talking about the president, him, he can have his opinion, let him have it. But the person whom you can see every day dancing on your graves, giving 10,000 the funeral, is your MP, MCA, and senator. Ask them to amend this SHA before it's too late.
Question. That's a good place. I like that.
That's a good place
I
to
like
start.
that.
I think I was also saying, as an electorate, we just elect the most daft, inconsiderate human beings. They
Sana.
you see, they I don't know if we have a certain greed that I cannot understand, because when we began the SHIF thing, the housing fund, and the opposition MPs were there. They were saying, this is wrong, this is bad, and right now it's just crickets. It's silence.
And then you flip it again.
And then
guys, why it was good.
It was good. Now it's bad. And that's why he's called on to us to actually, I'm telling you, 2027, we must, as an electorate, change the way
every
we
election
vote.
I've been called stupid because I've voted for some funny people.
It's not even that they're funny, they're just not popular.
There was a day I went home and I had nikaambiwa na my mom, umepoteza kura.
Yeah.
Nikaambiwa nimepoteza kura. Because I voted for someone, I went like, this is the guy for us.
Yeah, this is the guy for us.
Kasema, nikaambiwa, kai, karomba. Umeharibu kura. So we have to fight this mindset.
We do.
Come 2027, hakuna yuko ni manze, ni kila mtu ujue umsi ni nini anakuwekelea kwa meza na uende na yeye
kabisa.
Kabisa. Let me ask you a question, DJ.
Yes.
If I gave you a ball and shook it and told you, put your hand and grab something out,
you'll grab something.
And when you grab something, if that ball was of oranges, you probably grab an orange. Get that? Leaders are a representation of who
we are.
You get that? Wajinga ni sisi.
But do you know there are actually some good people who actually stand?
You get that? Us, I'm telling you.
But I see what you mean. There's
an English saying that the cream always floats to the top.
Yes.
But so does scum.
True. So does scum. That is true.
Yeah. So it is us who we have to, first of all, as ourselves as Kenyans. What are our value system? How can you be somebody? You tell your child, don't insult people, don't steal. Yet yourself,
you're stealing.
That school fees you're paying from stealing.
It's stealing.
And they
go for it from stealing. Everything that you tell them not to is what you are. You tell them, love your brother, come on, love yourself, stop fighting. And you're hating your neighbor, hating the other tribe. Yet you're telling them. So I really feel sorry for our children. Because whatever you're teaching them at home, vis-a-vis what the parents are doing out there,
is so different.
You get that? So we have to ask ourselves as Kenyans, what's our value system? Do we really hate corruption, or we just hate that we're not part of the stealing?
Oh, wow.
We get that?
Wow.
Yeah.
That's the only way we're going to save our country.
Wow.
Yes.
That's the only way
Ooh.
we're going to save our country.
Do we hate corruption or do we hate that
Wow.
we are not part of it?
Love it.
Yes.
Love it.
I mean, I don't know what else to add.
Me, I can't add.
I don't know what else to add. That was amazing. Just now parting shot. Dr. Dennis, what is it that you would like to achieve? Tell us your plans as you wait for 18th, what you've asked the government to do, what exactly you would like them to do. Oh, and we are joining you thoroughly. That, the Mandamano, we are there 100%.
Inject.
Kabisa. And also, Karumba, you can tell us what you would love to see. Like now you have gone through the pits of having a sick wife, what that has done for you guys financially, like what you'd really like the government to do for us. They might not listen, but I feel like we have a part in playing in what it is we want the government to do for us. So this podcast is just to get our voices out there as much as possible. So we'll start with Karumba and then close with Daktari.
We are somewhere. It's not where we want, but we are somewhere. We don't love where we are, but we are somewhere. For now, the way forward is to forge for as many amendments as we can.
Yes.
As many amendments as we can. The biggest challenge is, unfortunately, our MPs are all in the White House. They're pocketed in the big house just up the hill over here, unfortunately. So if the guy up there decides we do amendments, we can do these amendments. So literally, he's the one running this country. Our own CS is a puppet.
She is.
Unfortunately. The guy upstairs is the one running this Ministry of Health. Can you imagine? He's running the country and health at the same time.
And every other sector.
Unfortunately. So,
yeah.
But we remain optimistic. Kiboko yenyu inakaa.
Kabisa.
Aki inakaa.
Inakuja. Thank you for that.
Yes.
Daktari, with your wise words and stories.
Yeah, things are not so bad. I'm a very happy person because when I first joined the union in 2010, I was in third year medical school. We just used to try to push the healthcare stories. We'd beg that highlight the healthcare. Healthcare is all you have. Forget about the roads. Those roads will only be used to carry dead people. Forget about even the tap to water. That water will just be used to cook in your funeral. Let's talk about healthcare. Everybody's a potential patient. Yes. Nobody's coming out of this life alive.
No one.
True. If you're lucky in your sleep, but either you'll fall sick or in an accident.
Yes.
Even if you have a nice private cover, let me tell you, when you are from Masai Mara with your family, middle class in a nice Range Rover, just some drunken driver will hit you and you'll end up in a public hospital as your first point of call.
Exactly.
Wow.
There are those South African tourists who got an accident around the Machakos Junction.
Yes,
they had a nice cover that could allow them to be airlifted. But first port of call was Machakos level 5. When you finally need that care, you'll find yourself in a place that you did not know. Your card won't treat you. So let us fight. And people are fighting for that care. I'm glad that every other media house podcasts are talking about healthcare every single day. Brings joy to my heart. That for once, we are giving healthcare the importance it deserves. And I'm sure I can dare say that this government will either stand or go down because of healthcare. And it gives me a lot of joy in my heart that we have the chance to fix this nation when it comes to voting. And to Kenyans, let us be outspoken around this issue around healthcare. We have made healthcare so private, and I'm so proud of you, DG Kruber, just bringing out that story. Because people have made healthcare and death so private that when a school fails, we carry twigs and chase headmasters. But when a mother dies giving birth, we never carry twigs to ask, why did the mama die?
That's true.
When a child dies from malaria, we say, God has plucked an angel from the garden. Which God plucks a 3-year-old angel and leaves a Chinese to live 200 years. At least God's different. Who makes a child die with a dream at 3 months
True.
and somebody lives beyond their dream at 104?
Sure.
Let us put pressure. These MPs, they only know when you light fire. They might love Ruto so much, but I know they love themselves more. So when you light fire under their feet, I'm sure they're capable of doing what's right. That's what brings joy to my heart. And I'm so glad that you are doing this and that every other podcast out there is doing this. Let's push from all angles. Young people, we are the majority of the voters. Let's push from every single corner. They will. It's out of the pressure of the earth that diamond is forged.
True.
Pressure is easy.
Izidi kabisa. Hey, I don't know what else to add. Just one quote, the way he said, our health is everything. There's a quote that says, when you lose wealth, you lose nothing. It's when you lose wealth, you lose nothing. When you lose your character, you lose something. But when you lose your health, you lose everything. And I think just because haikufanyiki sahi, don't think that it might not happen to you. It takes something so small. Maybe just sleeping in the bathtub, your hip is broken. It can be you're cooking chipo, the oil foils on you. Like, it can just be anything. And so that's it for our episode. I'd really, really like to thank my guest. This was a very fun episode to shoot. And so see you guys next time. Stay engaged, stay informed, and see the nation through the Civic Lens. That's it for this episode of the Civic Lens, but the work doesn't stop there. The power to change our society lies with you. Join the conversation, follow Youth Clan and Civic Rise on social media handles. Until next time, stay engaged, stay informed, see the nation through the Civic Lens.